When people travel abroad and they get bit by a mosquito, right, I kind of explain to people it's kind of like playing roulette, right? And the odds are probably about the same, which is you're not likely to win, but in this case, maybe you don't want to win. That's getting the disease, right? So your odds are stacked against you that that mosquito that you maybe got bit by at that one time is carrying either dengue or Zika or chikungunya or any of the other viral diseases that are spread by mosquitoes. So the first thing is calm people down. Just because you got a mosquito bite does not mean you have some exotic infection. That's the one thing that physicians will hate if you refer all your patients who got mosquito bites when they traveled abroad. They will never refer back to you again. Because what you're doing is you're creating some hype with the patient that may not be warranted. So the first thing to remember is there are certain parameters around Zika that are a little unique that we think about, right? So for example, a male who's traveled to a Zika infected area, but maybe has not been diagnosed, whether they got mosquito bites or not is irrelevant. They've not been diagnosed and they don't have symptoms of Zika. When they come back, they should use barrier contraception such as condoms or abstinence for 8 weeks after returning to the United States or to a non-Zika endemic country. Right? For women who travel abroad, if they are pregnant or they became pregnant while they're there, we still don't recommend routine testing for all pregnant women who have traveled abroad. Again, getting a mosquito bite or being in an endemic area does not equal disease. So people still need to have symptoms before we start testing. What we don't want is a lot of mass testing, which then pushes the limits of our sensitivity and specificity on our tests that may either lead to false positives and anxious patients. So until the CDC changes their stance and maybe does go to universal screening of people returning from Zika endemic areas, the best thing we can do is tell patients what are some of the symptoms, right? So from fever to joint and body aches and things that are just very common with these family of viruses when they come back, to get in to be checked out by their physician. That's the best thing we can do, but not have them react to a mosquito bite and not have everyone get screening with blood tests just because they've traveled somewhere. We still need symptoms. We still need a good reason to order the test.